mainly it's the pressure of when to have a child, and everybody's delaying more than ever, and so that has the natural worry about the clock, which is more for women than men because of the system design. But that drives a lot of it. So it creates pressure, because the elephant in the room always with my patients is what if I can't have a baby? And until you do, that question is always there. And if you're starting to try and things aren't happening and you're expecting it to be quick because you've been told have sex one time you're pregnant your whole life and it's so easy, you're in control, two things that are completely wrong. But they told us that when we were young, so we didn't make bad decisions when we were kids, so it's probably a good thing. But it's a lot harder to get pregnant than you realize, and probably it requires more education, and in a way that is respectful, but also, kids are smart. They should know these things younger, not older, and it shouldn't put pressure on them or have them make bad decisions. Well, it's only a 10% chance. I'm 16. What the heck? I'll give it a shot tonight. I don't care. No, I'm not gonna make that mistake and have an unintended pregnancy. But the dialogue about planning your fertile life really needs to happen more now than ever, because we clearly are waiting longer and suffering because of it. One of the reasons someone like me is so busy is, we're kind of the evolution of the lack of evolution, because we're stuck with this 300,000-year-old system that was designed for women under 20 having babies and not beyond. And now we're having our families in our 30s, and the system just isn't designed for that, and it's very inefficient. Miscarriage rates are higher. Just getting pregnant is harder. 25-year-old fertile couples, takes 13 months of trying for them all to be pregnant, except they're not all pregnant at the end of 13 months. 1 in 6 to 1 in 8 couples are infertile. It's about a 10% chance per month. At 40, it's about a 2% chance per month. And at 40, you miscarry 40% of the time because the embryos are chromosomally abnormal more frequently with older eggs. And it's only 15% miscarriage risk at 25, except it's a 15% risk at 25. Even at 25, you make a lot of abnormal embryos, and that's why a lot of them don't make you pregnant, and that's why a lot of them result in miscarriage, and that's why it can be really hard and take a long time to get that one, healthy embryo that makes the baby.
So what do you think we could be doing better now in counseling people in that preconception period?
Yeah, it's really tricky because it's a double-edged sword. It raises a lot of anxiety because the awareness of that creates pressure, but it's much better than what I see a lot of times. I'll see someone who's 40 show up and say, "Gee, doc, I've tried 2 months to get pregnant. What's wrong?" Really? What did you think your chances were in 2 months of trying? It's like, well, no one told me that. I've been healthy. I've been taking care of myself. I should be pregnant, shouldn't I? And that's a way worse outcome than any anxiety, because that patient who's been in denial the whole time and may not be successful doesn't end well. It's really sad when that happens. So it's a balance between the right amount of information in the right way that doesn't create anxiety and cause a lot of pressure, but is education, that you understand that you're making reproductive choices either by totally ignoring the whole thing and just letting life play out, or you're making reproductive choices by being aware of what the data is and then factoring that into the choices that you make. And I think it's really important that if you don't know the science behind it and understand the biology behind it, then you're set up to be disappointed if things don't work out well.
And if we were to paint a picture of what a prepared patient would be, like somebody you would want walking into this room, kind of like what are the different domains or the different areas you would want them to be prepared on, and what would make that relationship between you and the patient optimal?
Yeah, first of all, what's really important is that people should know they should seek medical care before they get pregnant, because there's a lot of preventable things that can happen. Now we have tests where we can check for 281 recessive gene mutations that you might carry, that your partner might carry one of those as well, and then 25% of your babies get an illness, and we can prevent it by knowing that ahead of time. Once you're pregnant, the only thing we can do is tell you at 16 weeks whether or not, you know, that baby's healthy or not. And in the case of carriers of recessive genes, that's a 25% chance you're going to get to either 13 weeks and have a CVS, chorionic villus sampling, or 16 weeks and have an amnio and be told, sorry, your baby has this disease, now what? It's not a place you want your patient to be, and you don't want to be as the doc. It's just awful. So we can prevent those circumstances by, you know, go for a preconceptual consult, go see your OB, talk about getting pregnant, do some workup to see if there's any problems that you're going to face in pregnancy so that we can make your pregnancy safer. So that's really important. And then, you know, people need to think about their lifestyle, and nutrition is a big element. And smoking is the absolute worst thing for fertility, especially women, not so much men. You know, we really need to get that out of our. There's no reason in the world to be smoking. It's really, it's sad that, you know, and yet nicotine, I'm very empathetic, is one of the most addicting substances on the earth. So once you start, it's really hard to get off of it. But that is one thing that clearly, especially affects eggs more than anything. And especially if you're going to be having babies when you're older, years of smoking is going to make your chances less.
And are there any other sort of lifestyle things that you recommend?
You know, it's funny. People get so worried about stress. Like, we love stress. We live in stress. That's our lives. You know, not enough stress, we're bored. Boring is not a word we should use, but you want to balance it. You want to manage it. But it's not contraception. And if it was, I mean, instead of giving you birth control pills, we just send you to New York. You'd be stressed, you won't get pregnant, right? So I think there's too much talk about that as a cause of infertility. It's really not. It just makes it harder when you're going through the process, because the process of being treated as an infertile patient is stressful and upsetting and depressing. And you throw stress on top of it, and it makes it even harder. And it's already hard without the stress. So, you know, managing your stress and learning how to do that will help you manage the process. And then, by the way, when you have kids, you think that's stress-free, so you got to know how to manage stress. So it's a good training ground for pre-parenting training.
And if someone is feeling like they want to be proactive in that time frame you're talking about, what would your advice be to them on how to think about choosing a clinic and the right provider for them?
So talk to your friends, talk to lots of people. It's much more open now. And there's also things you can find on the web, some very inaccurate and some very accurate, and that's always the hazard, because how do you figure out what's what? And that's not easy. You know, in local markets, you really want to just talk to people, because there's information there that you can get. And then, you know, you want to be comfortable with not just the doctor, because the doctor isn't the only one who takes care of you. I have a whole team of people who make sure you get good care, and I'm only as good as my weakest link. And so, you know, the person who answers the phone, the person who manages your blood work, the person who manages your insurance stuff and making sure all that happens right, and helps you understand that piece of it. So everybody has to do their job, and you have to have a clinic where it's organized in a way that it's patient friendly. And that's probably our biggest, hardest job, is coordinating all of that and getting better, and then adapting to the changes that we make and getting better. And that's we spend a ton of time on that, just making the patient experience a better experience, because a lot of things happen, and bad things. You know, if someone miscarries, it's awful. And what's the right way to help that patient through that? And that's as different as the patient, because some patients, they don't want to hear from you. They get upset because you called them, and some patients get upset because you didn't call them. And how do you, you know, figuring all that stuff out is a real challenge. And just really helping the patient feel cared for. And so, you know, what I usually tell my patients, I say, look, we don't know what you're thinking. We're not going to guess. Your job, you know, we're here to help you. You have to tell us what you need. If you tell us what you need, we're very responsive. If you think we're going to figure it out on our own, it's not going to happen. And in fact, what I found is, I say to the patient, look, when you're infertile, you feel out of control. and you feel, a lot of things that are not pleasant. And so what I like to do is give you control by, okay, here's your job. Your job is to help us help you. Your job is to keep us on your case. Your job is to tell us what you need, ask us questions. Don't ask, I have a dumb question. There are no dumb questions. I'm sorry to bother you. Well, that's why we're here, to be bothered. It's not always the doctor who's going to answer every question, because we can't. And quite frankly, we have better people than doctors answering some of the questions that you're going to ask. But help us help you. Tell us what you need. And then we, as providers, have to be, okay, here's the issue. What's the solution? And know how to triage that properly so that the patient gets cared for. So I just say to the patient, look, you got to help us do that. And how do you do it? You just tell us. Tell us what you need. Tell us what you're unhappy about. Tell us what we can do better. And then everybody has a better experience, because, we're not doing what we think is best for you, and that's not best for you. Something else is best for you. So it's a real challenge.
So I'm sitting here in New York, and I know a couple of months ago there was an opinion in the New York Times, reported by the New York Times, that was by 2045 most couples are going to need assisted reproduction. So firstly, what's your opinion on that? And secondly, what's your opinion on kind of the emerging technologies and the ones that might exist by 2045 to enable
So, look, right now in the United States, 2% of the babies are born through IVF. We are using more and more technology. We are freezing more eggs because women are purposely, by plan, delaying their childbearing. So we're going to be more technology dependent. To make a prediction that in 2045 it's all going to be, that's the way we reproduce, it's possible, but I'm not going to guess. I have no idea. And there's often something that will totally disrupt whatever technology we have that's completely different, that no one ever thought of would come up. And so who knows where that's going. But I think people who are going to be having their babies older are going to be using more technology, because natural pregnancy doesn't happen as often, as you get older. And there's ways around and avoiding some of the things that happen, like miscarriage, which happens much more as you get older because the embryos that you make are chromosomally abnormal. Doing IVF and finding the embryos that make the babies and avoid the ones that make the miscarriage, so you don't lose 3 months of trying at precious time. You're 40 years old, you lose 3 months, that's a big, that puts a dent in your overall chances. If we can lower your miscarriage risk from 40% down to 10%, and we have technology to do that, that's a really positive thing. Avoiding multiple pregnancies, so yeah, we're going to be using more and more reproductive technology. But you know what? There may be a shift too towards having babies earlier too, as the next generation sees what this generation's going through. They sometimes adapt and change. So we'll see how it all plays out. We just have to keep getting better and better at what we can offer to get better outcomes, avoid a lot of the problems, reduce those risks, and just have healthier outcomes. That's really our job. And the predictors, they can predict whatever they want. We'll just react to whatever happens and try and just help our patients.